Okay, so my first tip is to make yourself a strong candidate. And how you do that is you improve in all areas where you need to improve. So how you do that is, one, education. It's very important to have a strong education, whether that be going from a very well-known school, would it be acquiring more degrees, certifications. You absolutely want to set yourself apart from everyone else. So for me, I graduated with my associates in nursing, but I did previously have my bachelor's in biology, but no, I do not think that helped me at all as far as nursing. So of course I went for my bachelor's in nursing, which I did complete in a year, actually about 11 months to be exact. And I had a very strong GPA of a 3.94. And although that's not something that employers typically see, it is something that you're able to mention. And also, because I did well, I was also inducted into Honor Nursing Society, which I did also pay for a membership for, because I feel like that does help. So that's one way. Certifications. Any and all certifications you can get, or CEUs, absolutely do it. Because anything that you are able to do and pay for on your own, that's one less thing that your future employee has to pay for. So I would say get your ACLS, BLS, PALS, anything like that. Especially if you're gonna do something that's a little bit more specific, like if you're gonna work with children, definitely do your PALS. For me, I did my ACLS because I knew I wanted to go into critical care, and it's a must of critical care, so it does help when I have the ACLS. Although the hospital will train new hires, it's one less thing they have to worry about. So education is a definite. So education, certifications, definitely do. Second is professional experience. It's very hard to get professional experience when you're a new nurse and you don't have any ground to really stand on. A lot of people want people who already have experience, they know what they're doing, so they don't have to spend as much time training. It's a difficult fact to deal with because it's very hard to get your foot in the door when you don't have experience, but any way you can, do it. I started off in urgent care, and it's very different from a hospital because we don't do as many IVs, we don't do as many blood draws, we're not seeing everything, and we're only getting patients for like snippets of time, about 45 minutes to an hour. Whereas hospitals, they're there for days. So it can be very different, and you do lose some of your clinical skills in doing that. But for me, I feel that it was important for me to get a job somewhere as a nurse and to gain some type of experience. What the urgent care did bring to me was my ability to multitask and time manage, which is a huge thing because I'm ranging from anywhere from about 40 to 70 patients in a day. So you absolutely have to stay on top of it. You also are introduced to a lot of different diagnoses because you're getting a bit of everything coming in. You also have to know how to react quickly in case of emergency, because sometimes people do come to urgent cares instead of ERs for urgent issues that they should have gone there, but they don't know any better, or they want to save time, whatever it is. So I did get some experience that way. My advice to you or anyone in nursing school is to get a tech position. Hospitals generally like to hire from within, so I feel like that helps a lot. A lot of people that I actually graduated with already had positions in the hospital, so they were the first ones to be hired into the hospital and just transition into a nurse position. Whereas me, even though I had my bachelor's in something else and I had hospital experience working as a tech, I did not have any, I was a contracted tech, so I didn't have any way of getting in hired within. So you have to make yourself stronger in other ways. So for me, I did it through education with my BSN in a year, and then certifications, my ACLS, BLS. And then I'm also certified to do drug testing, breath alcohol testing, all things that came with the urgent care setting that are not necessarily applicable to the hospital, but education never hurts. My second thing I would say is networking. Networking is very, very, very important. Anytime you meet someone, get to know them, be very genuine. Don't do it just because like, oh, I know this person's gonna help me. No, you wanna get to know them because you can learn something from every person that you encounter. So I've been lucky enough to work with doctors closely because, it's just a doctor, a mid-level, me, a rad tech, and an MA during a shift. You get to know everyone. And I've learned a vast amount of knowledge from people. I think that's something that you can't fake, you know what I mean? You want to make those strong connections because they really do help. And later on, these are the same people that wrote me recommendation letters, people I'm able to put down as references. These strong relationships and networking are very important because it will help to secure a possible position for you. So get to know people, ask questions, learn from them. it's very important. I think it's a necessity, but I think it's also great because you make very good, strong networks with people, but also friendships. And these friendships are something that you can use later on, that when you have a question and you're doing something nursing, you can always call up one of the doctors and be like, hey, I encountered this today. What is your take on it? What's your opinion? Stuff like that. So that's definitely another thing I would say is absolutely important. Then for me, after I did become a nurse, I also licensed myself in another state. I did this mainly because the state is close to me, and if I was not to get a position within my home state, I'd be able to drive to another state. And I think that another thing that is very important is you're able to diversify yourself as a nurse. That being said, it can be expensive getting licensed in other states. So if it's something that's not easily attainable, then I would say do it later on at some point. Or if you ever decide you want to be a traveling nurse, it's an absolute must. So I did it, even though I have not used my second license at all. I just recently renewed it, and I think that it's better to have it than to not and have to go through everything all over again. So I'm gonna maintain the 2 states for now. And so in the future, if I ever decide I want to pick up any time at another hospital, I have that license and I'm ready to go. Another thing I could say to you is get recommendation letters. Even if you are not applying for a position at this point, or you're not looking for anything, have the recommendation letters, or at least have people you know that will write you a recommendation letter, and keep that with you, because it's important that when you do go for a position, you have it, or you're able to ask them to write one. So for me, I was able to ask the doctors that I work with, previous instructors, my manager, other nurses, nurse practitioners. Anyone who could speak to your ability to be a nurse is very important, and I feel that it's very helpful. So absolutely get recommendation letters, because it's gonna help. Even if it's something that's dated, or you've asked them not to put the date on there, that way you're able to give it to them from whatever time. But absolutely get recommendation letters. If you're in school, I would say take part in as many organizations as you can. I was a part of the student nurse organization, and that's where we did things that were specific to our school, as far as raising funds, stuff for our graduation, apparel, or anything like that. That's important. But I would say also doing anything else that is outside of that, that is a part of a nursing association, so that people get to know you, and they also know that you have a strong stake in the community. For me, community is very important. I worked in urgent care in the same city there where I actually went to high school, so I often encountered a lot of people that I went to school with. And I also did a lot of volunteering around that area. And when I did my actual final project for my BSN, I did it based off of my community. So I think it's very important to have a strong community sense, and to do things within your community. And then that will also later on help you out as well. So as far as schooling, as far as my BSN, having good grades always helps. Absolutely, because I think that my thing was, I knew I had to get good grades because I was really interested in becoming a nurse practitioner. So I tried to make my grades as great as they could be, especially because I felt that my undergraduate and my nursing grades, they weren't as strong because I'm not a good test taker. So even though I wasn't a good test taker, I really tried to force myself to become better, 1, and 2, to really make myself a very strong candidate with my BSN. So I got straight A's for my BSN. I got 2 A-, so I went from a 4.0 to a 3.94, which a little irritating, but fine, you know what I mean? I know I tried my best, and this was, I did very well. So I did become inducted into the Honor Nurses Society, and I definitely do advise anyone to join as many memberships, ANA, Honor Nursing Society, all of that, because it does show that you're participating in nursing and you're doing more than just your job. You're also trying to make changes within the nursing profession. So I absolutely recommend doing that. So as far as actually getting into to make an interview, a lot of that is just going to be how well your resume actually looks, and you know, what you type in there. So I've been told from previous nurses, like when I first started, is that you want to make sure that you divulge all your information. That means past address, past experience, past schooling, all of that. because they are gonna look into it. Make sure you type in complete sentences when they have like the open-ended questions. You absolutely wanna do that. Make sure your resume looks very clean, neat, a good amount of spacing, but keep everything to 1 page. I had an issue before last year, before I actually started, well, actually that's around the time that I started in that urgent care, was I had a 2-page resume, and I wanted to include everything to show myself that I was a very strong candidate. And I feel that it probably hurt me when applying to hospitals, because if you have more than one, they're really not gonna wanna look at it because they have so many applicants. So I would say keep it to 1 page.